Throughout the pandemic, elective surgeries have been put on hold intermittently depending on the state of rising cases, hospitalizations, and capacity challenges. But what is exactly considered elective? Amel Elhel joins us now live from Strong Memorial Hospital with more on this. Amel?
John, Katrina, the societal understanding of what an elective surgery is not the definition put out by most hospital systems. And according to URMC, if your surgery has been delayed, that doesn't necessarily mean it was considered elective.
Discs were pressing on my spinal cord, so I was losing feeling like in my fingers and hands.
Carol Cross has been waiting to have a 4-level circle fusion procedure on her spine since October.
You would think elective would be like a plastic surgery or something that really wasn't medically necessary, but that definitely doesn't seem to be the case.
But due to URMC putting a pause on elective surgeries, Cross had to wait 3 months before she could be pain-free.
It made me feel like people assumed that I was having some unnecessary procedure done, but then on the other hand, I was thinking about other people that were probably in worse situations than me that were still being considered elective.
Dr. Matt Miller with UR Medicine says there's a difference between what is considered an essential and a non-essential surgery.
Any surgery that if we delayed it indefinitely or for an extended period of time that would bring harm to the patient, we would consider that an essential operation. Anything that really could be put off indefinitely without risk of serious adverse effects to a given patient, we would consider non-essential, from a time standpoint.
And luckily, Cross advocated for herself, but says she thinks if she hadn't, she still wouldn't have her surgery by now.
Definitely think they should revisit what their definition of elective is. When you think about it, this is not something I would choose to do. It's something I had to do.
UR Medicine said in a statement they regret having to postpone the surgeries, but they need the public to get help by getting vaccinated, scheduling booster shots when eligible, masking indoors, and following other common sense safety precautions to prevent the spread of infection. Live in Rochester, Amel Elhel, News 8.
All right, Amel, thank you. Dr. Miller adds that most all surgeons are diligent about advocating for their patients who require their surgeries most.